In this video, I'm going to share with you 5 proven eye health tips that both improve eye health and prevent eye disease. So let's take a look. Hey everyone and welcome. I'm Dr. Peru. Today, I will help you learn about the eyes, vision, and finding the best vision products. I want to make this video to share a couple of eye health tips that are proven in the literature to actually show benefits for eye health and preventing future eye disease. Tip number 5, watch your cholesterol levels. At the bottom of the list is actually to watch your cholesterol levels and decrease your saturated fat intake. It's not really big medical news that having elevated levels of cholesterol and saturated fat in the diet isn't good for you, but it's certainly not good for the eyes either. There are studies that suggest that having elevated amounts of cholesterol and eating high amounts of saturated fats actually contribute to the development of age-related eye diseases, such as macular degeneration. Also, having higher amounts of these levels in your bloodstream contributes to other diseases like diabetes and high blood pressure, both of which actually contribute to different retinal diseases within the eye. Not only are there other diseases like diabetic retinopathy, which can cause blindness, and hypertensive retinopathy from high blood pressure that can hurt the eye, but actual cholesterol plaques that get released from this cholesterol getting stuck in your arteries can actually travel all the way up to the eye and cause a stroke within the eye that we call a Hollenhorst plaque. This means decreasing the amount of foods in your diet that have elevated amounts of bad fats, such as fast food or processed meats, including high-fat dairy products such as milk, butter, and cheese. This could not just be beneficial for your whole body and heart health, but also for the eyes. This is actually compounded again by having a decreased body mass index, so getting out and exercising. Tip number 4 is to increase the good fats in your diet, namely omega-3 fatty acids. In case you haven't heard, omega-3 fatty acids are considered the good fats that we find in some natural food sources, such as oily fish like salmon, as well as from some vegetable sources, including nuts and seeds. There's even an algae-based supplement that I found that you can actually take as an alternative to taking fish oil capsules as a supplement. Now, there's a whole lot of omega-3 debates on how omega-3 fish oils could help with heart health, joint health, or even neurological brain health. There are a lot of documented studies that show support that omega-3 fatty acids can help with dry eye symptoms as well as preventing retinal disease. What's really interesting is that research studies have consistently shown that people who eat a diet with higher amounts of omega-3s in them have a decreased risk of developing age-related eye diseases such as macular degeneration, as well as people with diabetes. In fact, a recent study found that people who had higher amounts of omega-3s in their diet and diabetes not only developed diabetic retinopathy less, but people who did develop it didn't have it as severely, and people who needed treatment for it responded better to the treatment. That's some amazing support for having omega-3s in your diet. And even if you're not diabetic, there is a lot of evidence supporting that omega-3s are good for your eyes and your whole body as well. Tip number 3, eat more fruits and veggies, eat more foods with high levels of antioxidants in them, that is, namely, fruits and vegetables. The high levels of powerful antioxidants that are found in foods like fruits and vegetables often contain high amounts of vitamin C, vitamin E, zinc, zeaxanthin, as well as a very powerful eye nutrient called lutein. These have all been found to be very beneficial for the processes inside the eye to keep the eye healthy and prevent eye disease. Mainly because we are constantly looking at everything around our world. That means the light is actually entering the eye and causing the photoreceptors within the retina to turn over and constantly regenerate, and that requires a very high amount of metabolism. A faster working metabolism causes more amounts of reactive oxygen species, with antioxidants basically negating that. In fact, there are actually eye diseases like macular degeneration, where it's standard of care for eye doctors like me to prescribe vitamins because it helps those diseases so much. So yes, just as you've probably heard throughout your entire life, eat your fruits and veggies. Tip number 2, take an eye vitamin. Tip number 2 is to consider taking some sort of eye vitamin supplement. If you're somebody who doesn't like eating fruits and vegetables, and you can't really stomach eating oily fish like salmon, then perhaps taking some sort of supplement is the best option for you. There are many different vitamins you can find in the market. If you go to the store, you'll probably be overwhelmed by the amount of options that you have for eye vitamins. In general, you'll probably see ones with the words AREDS written on the side. That stands for the Age-Related Eye Disease Study. Those are all large-scale studies that basically proved and found the benefit of using vitamin supplementation for diseases like age-related macular degeneration. If you're somebody who's never been diagnosed with a disease like that, you probably won't have much benefit from taking that specific formulation. But there are different vitamins out there to supplement for your eye health, mainly by increasing what's called the MPOD, which stands for macular pigment optical density. It's really the amount of structural support pigmented layer in the back of the eye. By taking these vitamins, you increase the amount of that pigment, and that helps prevent aging eye disease, mainly by preventing damage from high energy light that we get from the sun and digital devices. I personally still think it's best to try and eat healthy foods and get all of your nutrients naturally instead of supplements, but I still think it's a good option for those who maybe are concerned or have a higher risk for retinal or eye disease. But I do also want to mention, if you're considering taking some sort of vitamin supplement, make sure you talk to a medical professional in your area to make sure that it is right for you. Now, number 1 tip for improving eye health and preventing eye disease is something that I know a lot of people are not going to like to hear, and that is to quit smoking. That is because cigarette smoking and tobacco use in general are associated with higher risk factors of developing eye diseases such as macular degeneration, again a blinding eye disease that people get in their 50s and beyond, as well as the development of things like dry eyes, uveitis, a bad inflammation inside the eye, as well as a condition called thyroid eye disease. So, if you have any sort of thyroid problems for yourself or in your family, smoking very greatly exaggerates problems with your thyroid. But the reality is, it's really no big news that smoking is bad for your health. Which one of these tips was your favorite, or do you have any other eye health tips of your own? Go ahead and comment in the section below and let me know what you're thinking. All right, everyone, thanks for watching. If you liked the video, give me a big thumbs up and subscribe if you'd like to see another video.